Hello everyone, welcome back again to this channel and thank you for tuning in. You're most welcome. This is Grapham Academy and I'm excited to take you through this specific lecture. And in today's lecture, we are going to manage simple and self-limiting conditions. How we can manage them, what are the simple and self-limiting conditions that you may encounter in your practice, or not just in practice, maybe you as a personnel as well can suffer from them. So we want to look at the outline of today's class or today's lecture and appreciate the different steps. I assure you whatever you're going to get today is going to be of great benefit to your practice and whatever you're going to do and in your day-to-day life. So we are going to look at the subtopics or the outline of today's lecture, where we are looking at evaluate signs and symptoms of self-limiting conditions, then treat simple self-limiting conditions, supply medication to the patients having this or presenting with self-limiting conditions, or dispense medications to patients that are presenting with self-limiting conditions, provide first aid for these clients, and then perform simple tests. So we see that evaluation of signs and symptoms of simple and self-limiting conditions. There is need for you to know what are these self-limiting conditions. So we can define this self-limiting condition as a diseases or a disease process that resolves spontaneously with or without a specific treatment. So you find that this specific condition can dissolve with or without specific specific treatment being given to the patient. And we are going to appreciate the with or without medication when we look at the different examples of self-limiting conditions. So when we are describing or description that we may give to these alignments, we see that these are also called minor alignments or diseases that tend to cease after a definite time. They have a specific time that they can last in the body and they can dissolve, okay, with or without medication. Self-limited by their own nature, specifically running a definite and limited course. Usually they have no long harmful effects on a person's health. And we see that you may not need to waste money on a prescription for this self-limiting condition. You can actually have over-the-counter medication. You as a personnel can prescribe over-the-counter medication to your patients, and these alignments can be dissolved, okay, without a prescription. So what are the examples of these simple alignments or conditions? We see that we have flu, we have cough, and then influenza, we have pneumonia, and we also have typhoid fever. So what are the signs that someone can present when they're having cough? So with the running cough, with cough, a person may have a running nose and then may have frequent throat clearing and sore throat, may also have fever, and may also have shortness of breath, and sometimes may have sputum. When there are two types of cough, there is dry cough and productive cough. Yeah, so dry cough is the one without sputum, but a productive cough is when a patient presents with a cough with a sputum, like they are able to spit it out. So this cough is different from the cough, maybe the TB cough, the tuberculosis cough. So pneumonia is another one where we look at pneumonia presents with sharp pain in the chest, fast and slow breath. Shallow breath is also recognized. We see that there is fever, chills, dehydration, and malaise. There is fatigue and loss of appetite. And also you may have a clammy skin and there will be sweating as well. Like a patient can present with sweat. So how do we treat these simple and self-limiting conditions? when we look at cough, you can have honey and hot water, like you mix honey. This is non-pharmacological. That's why in the beginning, or in the beginning slides, we said we can manage them pharmacologically or non-pharmacological. So when you look at honey, when you put honey in hot water without sugar, you find that you may manage this because honey has a lot of effects on relieving cough. So you can also mix honey, maybe lemon juice and hot water, or you can mix honey, lemon juice, and you can also mix in garlic. This also enables to manage cough non-pharmacologically. And you can also, lemon actually is good because of its citric activity and the vitamin C that it may have. And you can also do the cessation of smoking, like if a person has been smoking, the person can stop smoking for the period they have been coughing. So no patient with troublesome cough should take the ACE inhibitors, okay? Angiotensin converting enzyme inhibitors are medications that maybe are given to hypertensive patients. Your doctor can prescribe it. Please don't go and do self-medication when you have high blood pressure and you take this. It has to be prescribed because they have to check your level, and also they have to find out whether it is high or low, and they have to assess you properly before they are administered to you. So we see that the symptomatic pharmacological treatment of a limited is of limited efficacy. Okay, so their treatment requires maybe pharmacological and non-pharmacological management. So how do you manage pneumonia? Majorly, you can manage pneumonia using antibiotic therapy in the mainstay, like is the main thing you use. So as well, your medical practitioner will prescribe for you or will get for you the right antibacterial for this specific condition. Please do not self-medicate yourself. Even if you're a medical practitioner, see another medical practitioner and carry out different tests so that you rule out that this condition is pneumonia. Not every chest pain condition, or when you're presenting with chest pain, doesn't mean that all the time when you're presenting with it, you're having pneumonia. So it has to be ruled out, okay? So even if I've given here an example, please do not misuse this antibiotic because it will bring about antimicrobial resistance in a way that you're taking a wrong medication for a wrong alignment, and then when you get a specific condition that will require that medication, the bacteria has already gotten used to that medication. So it brings about resistance in a way that you swallow that medication and it no longer helps you. So that's why I'm more specific for you to avoid self-medication, or mostly for these antibacterials, because they are not safe in a way that it brings about antimicrobial resistance. So this is more dangerous because you'll find that all the bacteria have adopted to the drug and they are binding to the active site of the drug, okay? Or they have modified their structure for this drug not to affect them or not to kill them, because some of the antibacterials can either kill them or make them dormant in the body, okay? So what are the factors that you need to consider during management of self-limiting conditions? You need to look at what's the cause of the disease and what's the type of the drug to be used in this specific treatment based on what a patient has presented. You need to have an idea or knowledge of what the age of a patient is. Ask your patient how old they are. Then patient social behavior and lifestyle, inquire from them what is their social behavior and what's their lifestyle. And then look at the duration and severity of the disease. How long has this disease presented to your patient? How long has a patient suffered with cough? How long has a patient taken having flu? How long a patient has taken complaining of chest pain? Look at the family history of the disease and genetic factors. You need to look at all these factors before you get or manage these conditions or simple alignments. Okay, so supply of medication. How do we supply medications to these patients? How do we dispense? In other words, for this supply, excuse me, I'm also having some of the simple alignment. Um, what symptoms? Yeah, signs and symptoms. So we see that selection of medicine, you need to know or select appropriate medicine for your patient. According to WHO, that is the World Health Organization, it provides guidelines and advocates for secure and effective medicine supply. So for medicines to be supplied effectively, you need to understand what we call the medicine management cycle, and you need to know the main steps that it has. We have a lecture on this channel talking about medicine management cycle. In your free time, get time and listen to it. So we see that we have selection. Okay, partly the steps you may have there. You need to know how to select the medication, and you need to know how you can quantify and forecast for the demand in that specific locality you're in. You need to appreciate the procurement procedure, and then you need to also know how this medication can be stored and how you can distribute your medication. You can distribute. In the previous lectures, we have looked at how the medications can be distributed. It can be internationally, where one nation supplies to another or distributes to another. It can be nationally, that is within that specific country. It can be regionally, where we look at different regions in that specific country, maybe Eastern region, Western region, Northern region, Central region, North something like Northeast, Northwest regions in that specific country. So that is on regional basis. Even on hospital basis, where you look at there is distribution from hospitals to different wards or departments within the hospital. And then finally, you distribute from those different departments to the consumer, and our consumers are our patients. Okay. So what do you need to know when you're selecting these medications? You need to have the essential medicines list, which informs you on what you can procure based on the standard and the setting of your facility. So a reliable health supply system will integrate supply management into health systems. It also develops an effective mix of public-private partnership and also enables to maintain medicines quality in distribution channels and ultimately increase access to essential drugs. So we should appreciate this list and essential drugs, and we should also know what are essential drugs and what specific population can essential drug cater for. I think that can be your assignment, though we have a lecture also in this same channel where you can look out for it and appreciate what it is. So dispensing of medicines to patients, how do you now dispense it to patients? We say that a pharmacy technician should use the following guidelines. Can be a pharmacy technician, can be a pharmacist, can be a pharmacy assistant, or any other health professional should have these guidelines at the back of their mind when they are exercising or when they want to exercise safe dispensing and labeling of medicines, which enable to provide good pharmaceutical services. Okay, so we see that proper understanding and ability to verify the prescription is very important. If a patient walks in with a prescription, you should be in position to understand and validate or verify this prescription. Because in the process of understanding, you are able to identify maybe drug interactions or maybe any possible adverse drug reactions that may arise based on the patient's history and what you have interpreted or verified in the prescription. And this, by identifying them early, it enables you to monitor your patient so that these drug interactions may not arise, or it enables you give your patient another option. Liaise with your prescriber in order to change as you explain to them about the drug interactions that you have identified or that can possibly come up. All right. Avoid dispensing multiple repeat prescriptions at the same time. Okay. And then extemporaneous dispensing and compounding. We see that incident record keeping should also be followed of daily events, whatever you have done that day, whatever medications you have dispensed, you need to record it. That's why here in our country, Uganda, we have the dispensing log where you dispense like the name of the medication, the quantity you have dispensed, and maybe by the end of the month, it can enable people in that facility to be in position to know the consumption of a specific medication in a specific period of time. So labeling of dispensed medicines, you need to label the medications before you dispense, because you have to give this patient drug information and make sure that the patient has understood. There is need for you to counsel and monitor your patient. Counseling and monitoring of a patient is very vital because you'll be in position to make sure that a patient is comfortable with whatever medication you're giving them and the route of administration that you are giving to them. So counseling of patients, we already have a lecture on counseling of patients on this specific channel. In your free time, kindly listen to that specific lecture, because this is just a repetition of that. So in case you may not find that time, you can pause this slide and briefly go through what happens. So how about monitoring of patients? We also have a lecture on monitoring of patients. However, let me take you through. We see that a pharmacy technician, pharmacy assistant, or a pharmacy professional should provide ongoing drug therapy monitoring. You should always monitor how a patient is responding to treatment. The benefits of monitoring is that you're able to identify adverse drug reactions as early as possible, and you're in position to discontinue this medication if the adverse drug reactions are life-threatening. So you find that it is really so good for you to keep monitoring your patient. They educate patients and caregivers on potential adverse effects. So you are in position also in the process of monitoring, you're educating your patients as well as the caregiver on different adverse drug effects and how they may present. And work with patients to ensure adherence to therapy and attainment of therapeutic goals. So another relevance of monitoring, you are in position to work with patients so that they adhere to medications or to the therapy that has been given to them, basing on their alignments that they have presented with. Actively review patients' records and make follow-up. You are in position to review their records and making follow-ups with them, how they're improving. If they are not improving, maybe there is need for change of treatment or change of therapy. You are in position to identify and resolve drug therapy problems, for example, adverse drug reaction, and communicate with the prescriber on adverse drug reaction that may have emerged. So how do you provide first aid to clients? Emergency care or treatment given to an ill, this is first aid now, ill or injured person before regular medical aids can be obtained. What you're going to give your patient, an ill person, before a regular medication aid is obtained is what we call first aid. So description and importance. We see that initial assistance giving or given comprising of relative simple techniques is first aid. And usually we see that it is carried out by a lay person or any trainee until professional medical assistance arrives. That's first aid. Enables assistance to the community, medical help, like you help the person who has been exposed, and before they get assistance. Okay, for example, maybe a road accident and there is bleeding, you arrest the bleeding as you wait for referral, like referring the patient. So what are the different forms of first aid that you may have? There is resuscitation, that is giving CPR for unconscious patients, and then bandaging your patient for those that maybe having fractures. You can, okay, bleeding, you can bandage. Fractures, there are specific types of bandage that you may apply to different types of fractures. And then first aid to the choked patient, like someone has been choked by food or something, you can apply first aid as you wait for referral. So that's that. So what are the different forms or types of simple tests that you can carry out? So there is a description of a simple test and their examples. These are simple screening tests that can be carried out easily by a pharmacy technician. They may include HCG test, okay, and this is majorly carried out to test for pregnancy. You should be in position to do this test. There is random blood sugar test for your patients that are coming for refill of their diabetic medications. You should be in position to do it. Blood pressure test for your patients who are hypertensive or hypotensive. You need to be in position to do that test. You can also have a malaria test where you can have a blood smear, and there are different procedures for obtaining what they call a blood smear. Or you can do the rapid test, that is the RDT. Most of us must have heard about it. You should be in position to carry out this test, okay, so that you are able to rule out the condition a patient has presented to you with, and should be in position to prescribe for them medications. So taking patient's history is a skill necessary for examination and involves the following procedure steps. How do you take history? Self-introduction. Introduce your patient or introduce yourself, and also let the patient introduce themselves. So after you have introduced, explain to the patient what you're going to do. And the main aim of you explaining to the patient what you're going to do is for them to give consent or for you to gain consent. You cannot perform any procedure on a patient without gaining a consent. So you find that it is ethically required for you to always gain consent. However, a specific group of patients that you may not get consent from them directly, you may need to get consent from the caregiver, or maybe you can have a surrogate person to give a consent. But before you do anything, before you administer anything, before you carry out any test, get consent from your patient. It's ethically required, ethical directive for you to gain consent. And a patient has a right to consent or not to consent to whatever you have explained to them, because their response is best can also be affected by the cultures, religions, and beliefs that they may have. Okay, so find out the presenting complaints that your patient has come with, find out the history of the presenting complaints, and then find out the post medical history. Find out drug history of the patient. Which drugs are the patient is swallowing? Has the patient ever swallowed this specific drug before you give them? And if yes, what happened when they swallowed that drug? Find out the family history. What's their family history? Do they have history of diabetes? Do they have people with cardiac history or social history? Like, you need to have enough information before you rule out a specific alignment. Review of other vital systems of the body. And then there is also need for you to have the summary of the history, ask your patient questions, and get feedback after completion of the process. So selection of a test to carry out basing on the patient history. So the test carried out will depend on patient history, age of the patient, investigations carried out on other vital systems, and then patient's consent. Without consent, you cannot go on. Okay, types of tests to be carried out, and then giving a test results to the patient. How do you tell the results to the patient? There is direct giving of the results or test results to the patient is complex, as it leads to anxiety among patients according to research. Okay, always receiving this information after you have carried out different tests, it will causes anxiety. So you need to have a technique, good communication skill, to know how you can present this information to the patient, irrespective of the type of alignment that you are carrying investigation on. However, a more technical way of giving these results is helpful and helps the patient understand the diagnosis. One will determine clinical significance based on his or her knowledge of the patient's symptoms and then previous test results and diagnosis. Managing tests. So this is how you manage the test results. Managing test results effectively is vital in quality patient care. So we have come to the end of our lecture. Thank you so much for listening, and keep tuned to Grapham Academy. Subscribe, like, and share to content in this channel. Stay blessed.